So we're going to talk initially about just what does it mean when we say effective engagement, and how valuable or how important is that really for a health plan? I'm going to just start off with a couple of kind of big picture stats to frame this discussion. When organizations are thinking about communicating with members, all too often what we see and what we experience is that we're really writing that letter from our own perspective and then asking the members to meet us where we are. And the shifts that we can have in terms of that sort of construct is to say, what is it that most fundamentally meets the member where they're having confusion or a pain point, or just we're meeting them where we know there's uncertainty? And so if we look at sort of member satisfaction that's been surveyed across organizations, and this persists across not just Medicaid, but duals and Medicare and commercial as well, but making sure members understand their out-of-pocket costs. And I'll caveat that simply writing what out-of-pocket cost definitions are is different than having somebody understand their out-of-pocket costs. Providing some level of health education and delivering useful reminders for preventive services. These are just a couple of the examples that we can use as a mirror back to our own correspondence to members and say, are we doing these things? And again, they're just examples, but if we can look at a letter and say, man, really all we gave was an ID card and then gave them a helpline to call if there are questions, we know that there's more value that we can squeeze out of the opportunity to write to that member. And this is to a huge degree. I mean, on a 1,000-point scale, when these things were addressed, this is a J.D. Power survey, over 200 points or 20% were the improvement opportunity just by making sure that some of these core tenets were really established. And so what does that all amount to? Well, you can think of this just even in your own life as a consumer of any product. It doesn't have to be a medical insurance product, but when you feel, and I'm sure you've all got brands in your head of the ones that make you feel understood, appreciated, a brand that is trying to urge you in the direction of getting the most value possible, those are the places where we are loyal to those things, where we have a more positive review of those things, where we would recommend them to others that might be looking for similar types of products or services. And conversely, if we're annoyed, if we're disappointed, if we're frustrated as members of a particular service or brand, we have way less likelihood, one, to stay with that if the option is given to us to make a choice and move to a different type of coverage. But two, there's just lower engagement. And what we know as sort of administrators of health insurance, lower engagement is going to lead back to higher costs, both to us as well as for financial strife for the member themselves. So bridging this gap is unbelievably important, and the correspondence footprint that you have with members is a really elegant, already in place vehicle to start upping the game in terms of driving this type of satisfaction.